Good evening, ladies and gentlemen. My name is Celeste Kelly, and I am here this evening to provide you with a brief report on preventing cervical cancer in the Arlington, Virginia neighborhood. Um, I would like to first start off this evening by first looking at what is cervical cancer. Cervical cancer is cancer that is initiated in the lining of the wall of the cervix. This cancer is developed due to the exposure to the HPV virus if left untreated. There are several preventative methods for this disease, ranging from abstinence, limiting sexual partners, protection during sexual intercourse, and of course, vaccination. We will also be looking at behavioral and environmental risk factors, technology based applications, theory, relationship to modifying health behaviors, and theory based intervention. First, let's look at preventative measures for cervical cancer. The surefire way of preventing the HPV virus, which can develop into cervical cancer, is through abstinence. With abstinence, due to the limitation or actually the eradication of any sexual partners, this is a surefire way of ensuring that one does not obtain the sexually transmitted disease of the human papillomavirus or HPV. Limiting sexual partners is also another way of limiting your chances of developing HPV. With limiting sexual partners, you are limiting the amount of individuals that you have become exposed to, and therefore being exposed also to individuals that they have been with. Protection during sexual intercourse is also another way of protecting oneself, ensuring that there are no chances of sexually transmitted diseases to be passed on. Also, there are vaccinations for the HPV virus, which is usually given in the early teen years, and there's normally a course of those vaccinations. Moving on, we will be looking at the behavioral and environmental risk factors. When looking at behavioral risk factors, these are multiple sexual partners, sexual activity at an early age, and limited education. As I said before, multiple sexual partners is one of the major behavioral risk factors because this behavior will not only expose you to multiple sexual partners that you have had, but in turn exposing you also to any exposures that they have had. So not only are you exposed to your sexual partners, they're also exposing you to anyone that they have been with. Limiting your sexual activity at an early age. As starting sexual activity at an early age not also leaves you open to having multiple sexual partners. It also can expose you to the HPV virus at an early age, which may be left untreated due to no signs or not knowing the signs to look for. Limited education is also another major behavioral factor. This comes into effect where if an individual does not know what to look for, if an individual does not have the proper education to know what to look for, the signs and symptoms, or even how to protect themselves, this in turn leaves them exposed to contracting the HPV virus and possibly developing cervical cancer. There are also environmental factors such as religion, cultural beliefs, finances, and medical care accessibility. In many religions, obtaining this type of education or this type of medical care may not be acceptable or may be frowned upon due to looking at the reason for needing this type of care, being sexually active. This is something that many religions do not condone. This is the same as well for cultural beliefs. Many cultural beliefs may prohibit someone from obtaining the proper resources needed to protect themselves or even the medical care needed to treat themselves if they have already contracted the HPV virus. Finances is also another environmental factor. When looking at finances, this may also prevent an individual from obtaining the education or possibly the medical care needed to combat the disease. When looking at finances, this plays a major factor in also when it comes to medical care accessibility. This may be the reason that someone may not have the accessibility to medical care, or it may also be that where that individual is living, the medical care may not be easily accessible to them. So these are some of the environmental factors that we will be looking at. Technology-based applications. There are numerous technology-based applications that can help with the eradication of this disease. We can spread the word via text messaging, email, billboards, or even little messages in certain of the apps that we have today. One of the technological applications that I would like to focus on is the cryosurgery. This is a surgery that is done is given due to someone that may have certain symptoms of the HPV virus, like warts on along the lining of the cervix. This type of surgery, it's a cryosurgery that goes in and it freezes these warts, and in turn providing an immediate response to certain symptoms that this person may have, which may have prevented them from developing cervical cancer. I think this particular application will benefit the community due to it will be easily accessible to them. It will provide immediate response to combating the disease. Now, with that being said, there's also pros and cons to the disease. The pros are, yes, it will provide an immediate response and it may provide immediate protection from developing the disease. The cons are individuals may not be able to afford the application, or it may be something that's not readily accessible to them. This, I feel, is one of the major reasons why this is something that needs to be introduced into this community. The theory that fits, I think the best theory that fits when it comes to providing the education, the application, preventative measures, and all of that to this community would be the planned behavior theory. My recommendations would be to implement this theory based on the needs of the Arlington, Virginia neighborhood, based on looking at age, what's accessible in the neighborhood, and what would be easily affordable to members in that neighborhood. The theory's relationship to modifying health behaviors. The theory of planned behavior, I think, would fit best with this community when it comes to modifying behaviors, because it will not only address behaviors before they have started, but it will also address behaviors after they have started to address both the beginning and end stages, and how you can attack it, how you can cater to different individuals, and how you can shape this program based on what each individual or what particular individuals may need. This will also bring a good relationship to the community because it will provide an immediate response right here in the local community that members can use and that you can actually see results and that they can see results from immediately. My recommendations in this case would be to implement the theory based on the needs of the neighborhood, what the neighborhood can afford, what's already available, working with what's already available in the neighborhood as well. The proposed theory-based intervention. What is the plan theory? What is the theory of planned behavior? This theory is pretty much the theory where you would look at what the behavior is and make a plan to work on the interventions of the current behavior, like multiple sexual partners or intercourse at an early age. These are the behaviors that we would work with to make sure that we can curb those behaviors, combat those behaviors, or even provide education so members know that these behaviors may not be what they should be doing. How we would put this plan into action. I think the best way to put this plan into action would be to attack it head on. Come up with a plan that will be developed directly in the community, in the Arlington community. Put the word out there, like I said, via text messaging, email, billboards. There's a lot of billboards in the Arlington Crystal City neighborhood that will provide readily and direct information on where members can go to find the information they need and also get the help they need. How we will be measuring the effects of this intervention. I think the best way to measure the effects of this intervention is look at how many people are involved in the program, how the community is responding to the program, and how many members of the community are actively using the program and getting the help needed. The impact that this will have on the community, I think this program will have a great impact on the community because it will provide immediate response to an ongoing issue in this area, and it will also provide a direct access to the information needed, the education, where the education can be provided, and where to obtain the necessary medical care. With that being said, that is my brief for this evening. Like I said before, my name is Celeste Kelly. I have some references here that you can look at to further that would further highlight what I've been saying and show how I would go about implementing these interventions plans. If there are any questions that you have, please let me know. Again, my name is Celeste Kelly, and have a good evening.